So one pattern or trend that we kind of noticed throughout your career and really over the last 2, 3, 4 decades in medicine is the resistance to testosterone and the skepticism around it. Can you speak to that skepticism, why you feel that exists and why some of it is completely unfounded?
Yeah. Doctors are born skeptics. Either it attracts skeptics or it's just trained into us to be skeptical of everything. And, you can get research studies that show anything. Coffee's good for you, coffee's bad for you. But to me, really the most compelling evidence, I didn't start with testosterone with any agenda. I didn't know that it worked. And what I tell people is just spend a morning in the office with me. You see a few patients and you hear their stories about what life was like before they went on testosterone and what it's like now that they're on it. And there's almost nothing that can convince somebody as much as that.
Right, the real human proof and you being able to see the change maybe in their energy level or their enthusiasm or describing their life at home. And I think that's something that people miss if you're only looking at a research study. And as you mentioned, a lot of things can be manipulated, depending on the variables or what particular, hypothesis someone might be testing. So I love that you have the in the trenches, seeing men who are maybe experiencing hypogonadal or low testosterone levels being brought into essentially a normal range where they should be and, really feeling their best. So with that resistance or sort of skepticism there, you sometimes hear folks mention things like, because of, I think, probably related to what we see with sports and also potentially bodybuilding and other sort of stigmas or associations around hormones, people think of it as, oh, well, if I take this particular type of replacement or I add this hormone to my body or this regime, I'm no longer natural, right? Because I think that's maybe associated with the lack of endogenous production or your body making its own testosterone. But what would you say to folks who maybe have the resistance or aversion to testosterone when they actually might be a candidate based on, where they are throughout their lifespan, potential declining levels, or they're symptomatic and they're just not experiencing that same quality of life that they were before?
Yeah. There's just a lot of misunderstanding about what testosterone is, and just the name comes with a lot of baggage.
Yeah.
What a lot of the public thinks about testosterone is about cheating athletes, people who dope for the Olympics and we think also of the bodybuilders. And that's not really who we're talking about for testosterone therapy. So testosterone therapy on a medical level is for people who don't have enough. They're deficient in it. And we use the term testosterone deficiency. The older term is hypogonadism. But I prefer testosterone deficiency. It's just so clear. And those people have a reduced quality of life. It's not unusual to see a man, let's say he's 55 or 60, and you say, how you doing? And he might say, I think I'm doing okay for my age.
Yeah.
And what that means, if we translate that, is that they think that they're okay compared to other people their age. But it also implies that things aren't as good as they used to be.
Right.
Now, not all those people are going to be deficient in testosterone, and certainly not all of them are going to need testosterone. But some of them might. And there's an opportunity that has not been fully appreciated in modern mainstream medicine to, when people aren't feeling quite right, to actually see whether there might be a hormonal basis for it.
Right.
We've broken down, in what we do in research, medical science, is we often have a symptom or a problem that we look at as an isolated thing. Does it change rate of heart attacks? Does it, with or without it? Does it help with, for example, with testosterone, we look at sexual function, erectile function. But the way that testosterone works in the body is it has to bind to a receptor. It's called an androgen receptor. And those androgen receptors are in almost all tissues. And the good news and the bad news around testosterone is that it affects so many systems, so many parts of the body, that it can be confusing about what it helps and what it doesn't. It's like there's too many working parts. At the same time, though, is that the men who are deficient in testosterone and are symptomatic and get treated can see benefits not just in one area or two areas, but sometimes in many. And sometimes it's hard to put their finger on what it is. They just say, I don't know, I just feel better.
Right. And that's, the true benefit of something that's systemic in nature versus just only having potentially one acute benefit. You did mention that sometimes based on, I think, conventional medical practices, maybe we are missing this, and that testosterone is sort of this blind spot in modern medicine. Do you attribute some of that to the lack of testing, or even including things like testosterone, free testosterone, SHBG, and estradiol levels on basic men's health panels? Because a lot of times, you go in for a primary care physician appointment or just kind of a basic checkup, we may see basically a blood count, maybe a metabolic panel, maybe we look at your lipids based on your family history. But I think oftentimes men who maybe are having some of these symptoms, or potentially are in an age range where they should be considering it, we have some physicians who aren't even really looking at this huge consideration when it comes to male quality of life.
Physicians have their own reasons for being suspicious of testosterone therapy. Number one, it's really not taught in medical schools. And, in medical school, you learn about a gazillion different medical conditions, and that's kind of your Bible, if you will.
Right.
And if it wasn't in your medical school education, maybe it's not real. The other is that doctors have a real negative reaction to things that sound too good to be true and are promoted.
Right.
So some of the reaction, I'm sure, the negative reaction that a lot of mainstream doctors have to testosterone is that we have these supplements that are poorly regulated and are marketed so aggressively, and they make claims about it improves your this testosterone or that testosterone, or you're active or you're free, and the guy hits his golf ball further, he's better with the women, he tells the good stories, and it's just nonsense. Those things actually don't really work. But there's a normal reaction to say, if that's what they're saying, and I'm not going to be suckered into that.
Right. And I think some of those products you're sort of alluding to would be the infomercial for the testosterone booster, or, various potential vitamin, mineral, or herbal products, when that's not going to elicit the same response as someone who is taking a bioidentical testosterone therapy or adding essentially exogenous testosterone to their own body. So I think that certainly created a bit of confusion there, as people don't understand the difference between this is something that is maybe a supplement that was just created and not necessarily going through an FDA approval process, or something that had clinical trials on it and research, whereas testosterone, we now look back, and as we're sitting down for this interview in 2022, we now have years and years and years of data on testosterone therapy.